Hello everyone. So today we are going to discuss the medicine case. A 45-year-old man present with monoarthritis of knee joint with a fusion. So what is the most appropriate next step of the diagnosis? So you have to tell about the diagnosis of this patient. Options are A option MRI of the knee joint, B joint aspiration, Charlie, arthroscopy with synovial biopsy, or D ultrasound of the knee. I hope you got the answer. I'm going to give you 5 seconds. Yes, the answer is B, joint aspiration. So let's discuss about why this is the answer and why not the other options are correct. So our answer is joint aspiration. As we see, the patient present with the monoarthritis with the fusion. This is concerning. We have to concern about different diagnoses like septic arthritis, which is the most common, or other arthropathies like crystal arthropathy, which include gout, etc., or other inflammatory arthritis, which required joint aspiration to differentiate in between them. And we have also, after the aspiration, if we are suspecting the septic arthritis, we have to do staining and culture to help the diagnose, making the diagnosis of infection. And we have to also do cell count to help differentiate inflammatory and non-inflammatory causes. So this is only possible if we do joint aspiration. Other options are not in this regard. So when we talk about other options, the option A was MRI of the knee, which is useful when we have a suspicion of the structural damage like ligament damage, ligament and meniscus tears, etc. And arthroscopy with synovial biopsy is useful when we suspect the TB arthritis, or chronic inflammatory arthritis. Then we go for the biopsy and arthroscopy. If we are suspecting any kind of cyst or the soft tissue pathology like any cyst or villonodular synovitis, then we will do the ultrasound of the knee because it helps in this regard. And in this case, the best option will be joint aspiration. So in this slide, I have discussed some important information that help in future questions. First of all, the most common cause of acute monoarthritis is septic arthritis, which is our case, especially if the patient is febrile. And if they ask about the best initial test for the suspicion of septic arthritis, the answer will be joint aspiration and culture, which is also gold standard. So this was our question. And if the question asks about the most common cause of crystal-induced arthritis, the answer will be gout. And some uh, high yield point about gout are these are the monosodium urate crystals, needle shape, and negative bifringent. So this information is mostly given in the question that you will find out your diagnosis of the gout. And if asked about the first line treatment of septic arthritis, the answer will be IV antibiotics and joint drainage. And remember that this is an urgent process. We have to do it urgently. And if finally asked about the most sensitive imaging for osteomyelitis in septic arthritis, the answer will be MRI to detect early bone involvement. So we can further reduce the damage. Thank you so much and subscribe to our channel Sword of Knowledge. Thank you for your attention.